So today we will start with some practical demonstration. Allora, io mi metto sull'83, with some practical demonstration of our of some of our products. In this case, we have a very simple case with two roots. This is my plastic patient. I like to call it my plastic patient. Actually, being serious, this is a very simple case with two roots and a denture to put on top, and we will find a way to transform basically this denture, which is totally removed, in what I like to call a semi-fixed denture. Basically a denture like this one, which is improved with retention, with attachments. Attachment that can be put into the roots. I will show you briefly the packaging of our products. Here you can see a very interesting product, which is OT Equator Pivot. Okay, inside you will find what you need. Basically, housings, retentive caps, and also the real actual pivots. I will show you them now. Those pivots, for example, OT Equator pivots, are of three lengths accordingly to the root we have to treat. So, you can see the packaging, and those are the pivots. Of course, keep in mind that every package has two pieces of 10 millimeters pivot. Another packaging will have two pieces of 9 millimeter pivot, or OT Equator pivot, and another package will have two pieces of 7 millimeter pivots. Today we will proceed with the 7 millimeter pivots, but of course all the pivots have the same head, the same retentive head. This is the retentive head where the cap will go and catch the undercuts. So this is a retentive cap. This is a housing, a metal housing for the retentive cap. With the proper instrument, we take the retentive cap and then we put it inside the housing. And the cap will go on the OT Equator head. Quando troviamo un caso non fare troppi zoom. Okay. So basically, this is the pivot once the retentive cap has take the head, has take the undercuts of the attachment. But what we need to do today is to insert the pivot inside the root. Here, stammi anche un pochettino per favore. Fermo così, perfetto. So, today, as you can see, we have here a model already prepared, okay, with the same OT equator pivot, which is already inside, okay? Okay. And I will put the retentive cap, the proper retentive cap, inside this denture, but on the second half of this webinar. Now, I want to show you that we have also other pivots, always in 3 dimensions of the base of the cone that goes inside the root. We have the microsphere pivots. Those pivots are always in titanium, like those one. And we have also the normal sphere pivots. Okay. So, a sphere of 2.5 millimeters, 10 millimeter long, 9 millimeter long, 7 millimeter long. This different length is for every root. We have root of different height, so we can choose the proper pivot to use on it. Those are basically the same thing, 7 millimeter, 9 and 10, but with a sphere of 1.8, so a microsphere. You can see the difference of the sphere. So micro, this one is micro, this one is normal, okay? Sorry, and I will show you also the OT equator, which is a low profile attachment. So it has a lower height compared to the normal sphere, but has a bigger retention, even if it is smaller, okay? But today, okay, we will work with with the pivots in this way. Okay. This kit is just for training, okay? This is it only for training. For sale, we have those kits, which have all the retentive cap inside. We have all the retentive cap inside. And we have another kit with the pivots inside. This is for the spherical one. For the OT equator pivot, we have a packaging with everything inside. We just missed the burr, the proper burr, which is this one, and this is a burr for roots, okay? We call it Moser burr. And this is the burr, the proper burr. The conicity of this burr is the same as the pivot. So only one burr for all three pivots. Okay? Very simple, very practical. Of course, this is a burr for roots, so for denting. Today, here I have my plastic patient. I cannot use this one, but I will use a burr similar but for plastic. But remember, we have the proper burr for the roots. So today I will use this one. Allarga un pochettino, per favore. Of course, I'm not a doctor, okay? So I would like to ask Dr. Roberto if you want to say something about how to treat a root. Of course, we need to cut the crown. We need to cut the crown and to lower the height of my teeth. And after all the endodontic treatment, the traditional endodontic treatment, we can proceed with the Moser burr, not this one, because this is for
Excuse
plastic.
me, Claudio.
Yes.
I'd like to say just one thing.
Please
the
do.
minimum dip of the pivot is 7 millimeters.
Correct.
7 millimeters is optimal measure to give retention to all the system. And in this way, I'd like to see that the 7 millimeters is the best way. But if we have a typical natural roots, for example, natural roots more longer, we can use other kind of measure. But 7 millimeters is the gold standard. Okay?
Thank you, doctor. That's why today I will use the 7 millimeter pivots. I forgot to mention, and I want to apologize for that, that every measure is has a different color of the cone of the sphere. So no matter the sphere on top, regardless of the sphere on top, we have the 7 millimeter pivot that is always in metal color, okay? A natural color of metal. I will try with maybe, okay, I think you can appreciate the different color. Yeah, now it's better. The 7 millimeter is in metal color, the 9 millimeter is in purple color, and the 10 millimeter is in green color. So you can always recognize which is the proper dimension of the cone. Of course, the same thing is also with the OT equator pivots. What you see more in the OT equator pivot is just the head, the retentive head, which is which is in gold color. This is actually, it is not gold. This is nitride coating for the titanium, okay? This is a hardness process that make the sphere of the OT equator long-lasting in the time, over the time. This because the pivot of the equator are intended to be a definitive posts. The spherical one are intended to be provisional posts, but we can transform them also for definitive posts, definitive pivots. We call them pivots. You can call them posts as you like. The idea is the same, basically. And I will show you now how to transform them. The OT equator have, if you see, notches and is sandblasted on the cone, while the spherical one has no sandblasting or notches, but we can produce them in a very easy way. So it's up to you to decide which one fits you best. Okay. Today I want to use them as definitive post. So I will take them with a and then produce some notches. You can use a diamond bar, will be the best thing, or you can sandblast the pivot, only the cone, not the sphere. And with a diamond bar, I can make some micro retention also on all the surface. This is a carbide bar. A diamond one will fit better this purpose, but it's okay anyway. First pivot, and please have a look here now. This one is still smooth. This one has some notches, some undercuts, some retention that will help the pivot to stay in a more durable way in the root. Again, the OT equator has already all what you need, okay? It's up to you again to choose what you prefer to use. Okay, now I need to check if my pivot goes inside the root. This root has been treated endodontically with the traditional endodontic technique. No need to change nothing in your daily routine. And we will use those that are the transfer, the impression coping, also called impression coping, that have retention for the impression material. But today we will use them as a kind of mounter, if you think with the, you see, I have the possibility to take the pivot inside them and to use them as useful way to take the pivot. In addition to that, we also need the rings, plastic rings. We have three kinds of rings. The gray ring, which has 0 degree, the green ring, which has 7 degrees, and the red one, which has 7 plus 7, 14 degrees of compensation. But why I need this? Because when you have a root, the root has a specific axis inside the mouth. Normally, we want our attachment to work accordingly to the occlusal plane. So normally, I have a ball attachment, okay, and a retentive cap. Of course, the attachment will be fixed inside the root, and I will have the retentive cap, in reality this one, that will be fixed inside the denture. But the denture, the patient, has an occlusal plane, okay? And I want that my attachment, will be perpendicular, so will be perpendicular to the occlusal plane, okay? This is the occlusal plane, and the best way is to have the attachment in this position, okay? So the denture will work in this way, but it's not always possible. Actually, it's never possible, because if I have a root or also an implant, I have a direction of my root which is different to the occlusal plane, okay? So I need a ring to orientate my attachment, because if I have the occlusal plane in this way, the attachment has this axis, I would like to have the retentive cap to be orientated to the occlusal plane in this way. And if I have, look how the cap turns around the sphere, okay? I would like to have the top of the cap will be in the same direction of the occlusal plane. I will show you on the model how to do this. So, for the beginning, I will need my pivot, my 0, in this case, degree ring. I will put it on the neck of the sphere. And then I will put the impression coping on top. In this way, I can manage my pivot very easily with comfort. So again, I take the other one, the pivot, the post, the ring, and then the impression coping. In this way. I want to check if the pivot goes inside. No. Not completely, okay? So, what I need to do is to take the Moser bar. I will take the Moser bar in the patient, in the reality. I will take this one, put into my handpiece, drill motor, and I will start to widen the channel of the teeth. Of course, you will do this accordingly to the length of the teeth, as endodontic procedures say. Okay. Now we'll check again if the pivot will go inside. Okay. But there is still something that doesn't work. Okay, here we are okay. Here the pivot goes completely. The ring and the you see here the pivot is completely inside. The ring, the gray ring, and the impression coping will help you not to go too deeper into the root. Will give you a stop, okay, a flat hand where the pivot stays firmly in place. In this root, I need to work a little bit more. it is okay, and also here it is okay. Of course, you should respect the rules and not make a hole too big, otherwise the root will easily break, okay? You should be very careful and do the proper things with the proper bars for the proper posts or pivots. Now, we have choose a composite cement, a dual cure composite cement for our purposes, and we choose this one. This is the OT Chem, and this is a one-to-one composite cement, okay, with a mixing cannula that works perfectly for these purposes. Okay, I will start to introduce some resin inside. Dual composite, sorry, it's not resin, it is dual composite. Okay, also here a little bit. Okay, I prefer to fill everything. When I insert the pivot, I will later remove the excess. And then I will insert the pivot inside. Okay. Okay, I check that all the pivots are in the went deep into the root. Okay. Okay, we need to wait a little bit this moment, and because the dual cure cement needs 3 minutes roughly to become hard, and we need to wait a little bit. In the meantime, I want to show you some differences between the retentive caps, because we have different retentive caps of different color. Why we have different caps of different color? Because we need to have a different retention from patient to patient. Okay, so no matter the diameter of the sphere, I repeat, 2.5 or 1.8, we have for each sphere the corresponding retentive cap and the metal housing for the retentive cap. So we have 2.5 retentive caps, and 2.5 metal housing. We have 1.8 sphere and 1.8 retentive caps and 1.8 metal housing. Every color has a retention, a different retention. Okay. The yellow is the, let's say, the weakest, the softer retention. This is the average retention. The pink one is the average retention, and the transparent one is has the stronger retention. In our experience, we suggest always to start with the weakest if you have a lot of pivots, or if you just have two, like in the case of today, you can start from the average retention, so the pink one. The transparent one, you will use it after sometimes when the patient comes to your attention, to your cabinet, and asks you for more retention. Okay, I will never suggest to use directly the transparent one, because otherwise the patient will always ask you more, and then you have nothing more retentive. So it depends on how many attachments you have, and in case you have a lot of attachment, I suggest to use maybe the yellow one, because you have a lot of attachment. If you have maybe only two, just start with the pink one. For your benefit, let's have a look of the retention that those caps can give you. So, for example, with the transparent one, with the transparent one, the 2.5, we can have 1,300 grams, so 1.3 kilos. With the pink one, you have 900 grams, and with the yellow one, you have 500 grams. The micro, of course, has a smaller dimension and has a weaker retentive force, but anyway, you can offer 450 grams. With the pink, you can offer 800 grams, and with the transparent one, you can offer 1.1 kilo. Okay. Why to choose? Why to choose? How you can decide which one to choose from normal, so 2.5, or microsphere 1.8. Depends on the space you have available into the mouth, because if you have a normal space, let's say in 90% of the cases, you can use the 2.5 sphere, but sometimes you have not such big amount of space, so you have less space, and then you can choose the micro one. But normally you can start with no problem at all with the 2.5 sphere, so the normal sphere. Another important thing is, I didn't speak about the metal housing, but now it's their time. We take again the retentive cap with the proper instrument, and we insert the retentive cap into the metal housing. This because the retentive cap works greatly into the metal housing. This instrument has a double side. This is the side of the normal sphere or for the OT equator. Retentive cap. Okay. You can also take the sphere, the retentive cap of the OT equator, which is lower but has the same diameter. Okay. Of course, also for the OT equator pivot or post, you have also for this different retentive cap of different colors. Okay. So with this one, you can manage the retentive cap for normal and the retentive cap for OT equator. If you turn the stem, you can use it for the micro, okay? Okay, our time to remove the impression coping has come, and we just remove them this way. Okay, very simply. Just take them out from the sphere, and we just remove also the ring from the neck of the sphere. Okay, never forget to remove the rings. Okay, as you can see, the ring and the impression coping didn't allow the cement to go in the undercuts of the sphere. You can see, that the undercuts of the sphere are clean. Okay, I want this, because if the cement goes in the undercuts, you lost your attachment, basically. You cannot use the attachment. So never forget to use the ring, the gray ring, and the impression coping to cement the pivot inside the root. This ring works. I will take 2 new rings. This ring works both on micro sphere and on normal sphere. The ring is always the same, okay? You can use this with the ring. The impression coping has 2 sizes. This one is normal, and we have another one here for the micro, okay? No. Yes. Sorry. I didn't see the impression coping for micro. Okay, you can see This one is micro. This one is normal. Okay, you have everything you need. Just to remember you, if you have any question, you can write them in the Q&A chat inside your Zoom, and you can, at the end, we will read those questions, and also Dr. Skrasha, if you have something to say from the clinical point of view, it can give you the best answer as possible. It's very good doctor. If you were attending the last his last session here in Zoom, you already know it. Okay, now I will just clean.
Excuse me,
Yes.
I'd like to say just one thing. I think that this kind of prosthetic solution is optimal in elderly people, but also is optimal for temporary denture. For example, if we, in a patient, we put some implants and we need to wait sometimes to while the implant are healing, we can hold the temporary denture through the natural routes. This is the best way to give a comfort life to the patients and at the same time to give a good healing to dental implants in the bone. Excuse me.
No, you're more than welcome, doctor. And now I will just remove the little excess of resin that we may have. Okay, of course, for me, it's very easy to do this because my plastic patient is very friendly. For me, I can also come from this side, but it will take you very short time. And as you can see, you can do a very clean job, okay, in a very few seconds. Okay. Now, again, I will have just a little water, sorry. Now it's time to put the retentive cap into the housing, okay, and to use the other rings. Okay, so okay, I have one already made. So for your profit, I will take another one into, I will put another one into the metal housing. So again, I take the retentive cap with the proper tip of the insertion tool, and then I snap it into the metal housing, okay? Here we are. Okay. So, let's go. I will make just a quick analysis of the pivots of the post compared to the occlusal plane, okay? I need to understand a bit how is the occlusal plane and choose the right ring to be used. What I can see is that this one is more straight in a way, let's call it straight, and this one is a little more tilted, okay? So I will use here the 7mm, no, sorry, not 7mm, the 7-degree ring. Please just have a look at the ring, because the wider hole of the ring should go first on the sphere. So here I have the wider hole, and on the other side I have the narrower hole, okay? I need that the wider goes first on the sphere, this way. Otherwise, if I turn it, you will see that it will not fit properly. You see, it's not properly fitted. Pay attention. I turn the ring, and now it's well seated. Okay, you see the ring that can turn around the sphere. Now I will put the protective disc, because I don't want the resin to go into the undercuts of my attachment. I will stretch it a little bit, so it will be perfectly fitted. And 1 and 2. Okay. And now I will put my retentive cap on top. Of course, in your daily practice, all this process will be more quicker, because of course now I'm teaching you things and I need to show you and to repeat step by step all the little details, of course, but don't be worried. All this process will be very quick. Now I'm taking all the time because we need to understand completely all the system, to understand very well the system. Okay, but have a look. This retentive cap is completely on this side. This one is completely on this side. If I have a look at the occlusal plane, they are not accordingly to the occlusal plane. So now I just take my ring and I move it in the proper way. I turn it in the proper way so that my retentive cap can be placed in the best, too much maybe, in the best way, or at least.
Excuse me, Claudio, I'd like to say that this step in the mount of the patients is very smart, because we can see directly the directional ring, and through tools we can move the wings, but it is a very smart steps.
Yes, thank you, doctor. And there is another thing to say. With the saliva, everything goes smoother, because here is all dry, and with the saliva, the ring turns better. Anyway, I will manage to reach my goal. Okay, I think I can be satisfied. Okay, so have a look here. This pivot, this pivot will be almost in accordance, in compliance with the occlusal plane. This one has a little bit divergency, has still a little bit divergency, but it's almost in the good position. So sometimes you can fully place the retentive cap in the best way. Sometimes you are around 90%, but it's okay anyway, okay? The most important thing is that the retentive cap are not in contrast between them. So one goes right and the other one goes left. This is very important, okay? They should be as much as in parallel between them, but also perpendicular to the occlusal plane, okay? So now we use a red lipstick, something very practical to understand if we have enough space into the denture for the retentive cap and the housing. Remember, the housing is only 0.3 millimeter, so take not such a big a space, more than a retentive cap. So it's a wrong common perception that the metal housing take more space than a retentive cap. Just 0.3 millimeter actually is nothing, okay? Even in the mouth. Mostly when you have a removable denture, you have normally all the space. Maybe doctor can support me in this. And I want to have a look if I have space. Oh, yes. I need to grind a little bit my denture because they give me some marks on the into the denture, sorry. We take a bar and start to grind my denture.
This step takes few minutes, but it's very important because we need that the denture fit very well on the mucosa. And for these things, we need to use, for example, fit checker, that is a temporary material that take a look on pressure spot. But another important steps to take information about the fit of the denture on the mucosa is the handling, because by the hands we can have a real feel of the fit of the denture on the mucosa. And it's very important that the denture, definitive or temporary, is well put on the mucosa. before to load the attachment.
Thank you, Dr. Skrasha.
Thank you.
Okay. I will go further on my investigation of space, and okay, I see that I need a little bit space here. You can see the pink mark here, yes. And in this side, just a little bit, yes, there, a little point. But I'm almost there. Okay, I made some.
Excuse me, Claudio.
Yes.
I have an answer for you. What happens if the denture don't fit very well on the mucosa, and in this way we load the attachment with a wrong denture that fits on the mucosa? Thank you.
Basically, there is a overload of the attachment, and the retentive cap will cause the wearing of the sphere. So we should always think from a prosthetic point of view that a denture should be stable and well seated on the mucosa, regardless of the attachment. Okay, think that there is no attachment. So you have to have this one, the denture that sits well and stable on the mucosa. Later, you can add some retention with attachment. But
okay,
if you don't have a stable and well-seated denture on the mucosa, you will overcharge the attachment and you will basically destroy the attachment. The attachment needs only for adding retention, not to stabilize.
An help to give retention to the denture. But the denture must be stable with the Howard force. Many compliments, my friends. Very, very good webinar.
Thank you. Thank you. I can be very confident because I know that you have you here with me as a backup, as a shoulder. And I will also ask, would like to thank to Stanislav, which is behind me. You cannot see him, but he's here and is helping me with the camera. And so with you too, I can be very.
I'm proud to be your shoulder.
No, no.
Because
you are my column. You
support
me. You hold.
Thank you. Thank you.
You are more than a shoulder. You are my column. I lost my bar. Sorry. I think I lost it here. You see, you told me all those nice things, and now I lost my bar. I have my emotion. Okay, I don't know where my bar was. Una di quelle appunto devo fare il buchino di una parte linguale. Okay, Stan will help me with my mistake of the. Ah no, I have here. Oh, she was hidden. It was hidden inside my box. I have it here. L'ho trovata. Stava nel box. Okay. Okay. So I checked that I have enough space now into my denture for the two housings. Everything is okay. The denture is stable. It doesn't move and doesn't go anywhere. So now I need to produce just a little hole with my burr on top of the I will show you better here. Okay, the camera now is on focus. I need to burr a hole here on top, and this hole goes in the here, basically in the lingual part of my denture. You can see, okay? Okay, I need this because I do not want some resin to be in between that will place my my denture in the incorrect position. So I need it to be as a whole event hole. Okay, and now only because I have a plastic model, I will put some Vaseline on top. I won't show you this part because it's not necessary into the mouth, only here. So basically, this is a trick, and it's not needed to be done in the mouth. But since we have plastic model, I need to do this. But it's not it's not part of your daily routine. So remember this. Ok, perfetto. Grazie. Okay, I'm ready. I have everything in place, and now I just need some, put them here, some resin to be cured. Sai che mi sarà strano? Mi sono dimenticato. Ci dovrebbero essere degli elastici là, mi prendi? Grazie. So, you take your traditional acrylic resin. Here, of course, we have a transparent denture, but just only for visual purposes. Normally, the denture are pink, of course. So you take your traditional acrylic resin, you mix it, and as soon as it has this hardness here, that is plastic, you can put it inside. I do not like the running resin, liquid resin, because goes everywhere. You cannot control it, okay? I like to work with a plastic resin, not too running, not too fluid. I check the hardness, it's okay. Everything is okay, okay. At this moment, I ask the patient to close the teeth, but since I have my plastic patient, I need to adopt some other kind of masticatory forces. And so I put a elastic on top to make it stable, okay? And we wait for the resin to cure. Of course, do not forget to use the transparent protective disc, this one that I showed you before, because they will allow, they will do not allow the resin to go into the undercut of the attachment. So you make a more clean work. Okay. That's good. Okay. So, okay, we wait the resin to cure. And in this time, I will talk about the OT equator pivot, okay? All the pivot, all the posts I show you are in titanium, so they are compatible with the patient, okay? They give you no problem, and also the caps, the retentive cap, are made of a specific plastic that on which we made the biocompatibility test. The retentive cap should be changed every 12 months. So always remember that the retentive cap should be changed every at least 12 months, okay, 1 year. Because they are elastic, and 1 year of function in the mouth, which is a very aggressive environment, produce the stiffness of the plastic. Since we are, let's say, so proud of the elastic retention of our attachment, we want to preserve this elasticity, and then we need to change the retentive cap every 12 months, so once per year. In this year, you also can have, you can also understand how the denture works, if it works properly or not, okay? So, in the meantime, the resin cure in this side, I will show you the same process. Basically, I have already fixed into the pipe, into the root, sorry, the pipe, the OT equator pivots. You can see they are the walls with low profile. You can see the difference between a low profile attachment and a spherical attachment. Okay. And I would like to show you also a particular housing that we can offer you in the OT equator pivot. This is the traditional housing, stainless steel housing. You can have it also in titanium, and it will be in a pink color. But I want to show you the smart box. This is a brand new titanium housing that can tilt one inside the other and can compensate the divergency of the root. So this one works between 0 and 15 degrees. This one works from, of course, 0 and 15, but can rotate 10 degrees more, and so you can go from 15 to 25 degrees per attachment. So every attachment you can compensate with this one 25. So if you have two attachments, you can compensate 50 degrees of divergency. With this one, you go up to 30. Okay? Again, this root is, let's say, straight, as I said you before, and this one is more tilted. So, based on the experience we had, we put always the protective disc. In this case, we do not have the rings with OT equator pivot. Do you remember, no? The gray, the green, and the red ring, we do not use them. In this case, we do not use them, okay? We can use also the impression coping. Sorry, I removed something so you can. I can use the impression coping directly on top of the OT equator post pivot. Okay, use it directly, and we can cement the pivot inside the root. Okay, one. And the smart box also, oh, sorry, I forgot to. Stretch always the rings, protective rings. Okay. As you can see, it's more easy to use OT equator pivots because we do not have to orientate the retentive caps. Okay? After this, I do the same work as before. So I will take my lipstick, red lipstick. I will try to see how many space I have inside my denture. Of course, doctors, this process, this one, can be more easy if you ask your dental technician to produce some space inside the denture where the post will be located. Of course, you should tell them roughly where they are, so they can produce, they can help you in doing some space. But anyway, you should do always this process in the mouth just to refine what they have already made. Okay, it's just a help for you. It's always best to fix the retentive cap inside the mouth. I think Dr. Skrasha can give you some insight in this. Ah, sorry, I forgot to have a look where I need to. Okay, I need to remove some raising here in this spot and here. I will check again if I have enough space. I noticed that the denture sits properly, it doesn't move, so I think we have nothing to do more, and I'm right, because I have no mark inside the denture. So I clean my housing, metal housing from the red lipstick. They are clean. Okay. I don't need some color anymore. I just refine a bit. And I take again my burr and I will produce a hole into my space for the retentive cap. Again, I will put some Vaseline because of my plastic model. You do not have to do this in the mouth. Okay, I'm ready, and now I will put again some raising into my denture. Okay, I'm almost ready here. Let's have a little bit of look on the other one. Let's see if everything went correctly. Yes. Oh, great. I have my two rings here. You can see my two colored rings are here, and here I have my retentive cap inside. But now, just a second, because my resin here is ready. Yes. Okay. As I told you, I do not like the running resin. Okay, okay, I think it's okay. And again, I will ask my patient to close his teeth, but since he has no other teeth, I will just do this. Okay, please note that I have here the little resin that goes outside. It's here. Okay, that's perfect. And now I'm sure that there is no more, the resin is here where I want to. There is no running resin all around my denture, okay? That's why I like to have a plastic resin, not too liquid one. Okay. Please do not forget. Okay. Do not forget to remove the rings here. Okay. Always remove the rings, because I put the Vaseline. I have some Vaseline to remove, but again, this is not a process you have to do in the mouth. Remember. Okay. I will clean also the denture. Just a second. Okay. please. And now, what I need to do is to remove also the protective disc, okay? This one should be removed from here and also from here, okay? Always remove them. And now I will start to refine my denture. Okay, so basically it took me very few time. As you can see, the retentive housing, the retentive cap are inside the retentive housing. I would like to see the edge of the metal edge of the metal housing, because in this way I know that my retentive cap is completely free from the raising. So this is what the shining border, you see the shining border, I would like to have to see this. And you can see the model has a very good retention, okay? That's why I say that, I don't know if you can hear the click, I will, this is what I want to hear, okay? When the denture goes in full contact, you will hear the click, okay? This is very important. So, this is a semi-fixed denture, okay? It's not a denture that goes all around the mouth, that navigate into the mouth. I like to say that. It's a very stable, very fixed, okay, denture. This is something that you can give your patient which is very aesthetic, very effective, and very practical. Let's have a look at the pivot or T-equator, the other one, the second one I put into. Stanno, sai che cosa mi manca? Me ne sono accorto solo adesso. Un estrattore di cappetta. Grazie. Okay, I'm cleaning my plastic patient from the Vaseline. Sorry. Again, this is not a process you have to do because you do not use Vaseline into the patient mouth. And I will check how things went Okay, here what we can see, we have the pivots are here, okay? The two pivots are here. And the two retentive caps are inside my denture. Sorry, I have some Vaseline on my hands and on my denture. I need to remove it. Give me just 1 second. Okay. And then here you can see we have still the protective disc. Okay, we remove it. We do not need it anymore. But here you can see we have a black cap. This is the smart box. Okay, but the smart box, in all the Retentive 3 system, what is black do not go into the mouth, okay? Because this is just a positioner for my smart box. I need to remove it with a proper extraction tool. Basically, this is a hook, no? It's like a kind of a fishing hook when you go fishing. And this is the black positioner cap. From the packaging, you will have the smart box with already directly with the black cap inside. Okay, once you do all the step and you have the smart box inside the denture, after you remove the black cap, and here you can see, maybe because it's very shiny, you can see the second housing, because those are one housing inside the other. Titanium, titanium, okay? The second housing will host the retentive cap, the traditional OT equator retentive cap. So, with the traditional housing, this one, you use this retentive cap. With the smart box, you use the same, exactly the same retentive cap. Okay? Have a look. We have the two different housing, traditional 0, 15 degrees, and the new smart box from 15 to 25 degrees. Okay? Also here, I want to see the shiny border of my cap, of my titanium cap. And in this case, I really need a few work on my denture. Okay, denture, attachment, and there is something in between. Okay. A little bit more work, but okay. Okay. So also here you can see I have my denture. Okay. And now you can hear the click. Okay. This is my denture and you can hear the click. So basically we have two removable denture, okay? No, we have two semi-fixed dentures because we have two kinds of attachment, pivot with spherical shape or post with spherical shape, and here post with half sphere. Okay, OT pivot block, OT equator pivot with their retentive caps. Okay, so I finished my work today. I hope that everything is clear. I would like to thank again Dr. Roberto, all my colleagues here, also Stan on my side, will help me a lot with the camera. I would like to thank Nicola, all the staff. And if you have a question, please write them in the Q&A chat. So with the help of the doctor, I will try to answer you.